Hi everyone, thank you for joining us today. My name is Kartika and I'm from Lead Square's marketing team and I will be your host for the day. I know that we're very close to the holiday season, but we all know when it comes to the healthcare sector, the show must go on. So, we are very excited to bring you a topic that we're going to cover today. We will be talking about how patient engagement can result in improved retention. I also have our wonderful speakers here with me. Let me quickly introduce them. We have Mr. Ashish Anand, who is the head of digital marketing at CK Birla Hospitals. Hi, Ashish. Thank you for joining us today. Thank you for making the time to join us today. And please tell us a bit about what we can learn from you in this webinar.
Hi, Kartika. Thanks for the opportunity to let me speak of what engagements and what progress we have done on the in healthcare sector with respect to patient engagement experience, and what uh, we would be covering and looking forward to is cover mostly on how COVID has transformed the way people have interacted with healthcare, and overall at an organization level and at a sector level, how it has transformed the way the organizations have started to look at the entire technology and digital piece in healthcare. And lastly, how has the expectation both on the patient and the hospital side, and how has the focus shifted from just being a service delivery player to creating an entire delightful experience of the customer throughout the journey, right from acquisition to a checkout from the hospital and also afterwards. So this is what we would be covering on in this session, and probably overall transformation journey what healthcare is going through.
All right. Thank you so much, Ashish. I'm really looking forward to learning from you. We also have Ms. Shraddha Somani, who is the Director of Key Accounts here at Lead Square. Hi, Shraddha. Thank you for joining us. Please tell us a bit about what you are expecting from this webinar.
Hi, Kartika. Thank you for having me over. I think I'm extremely excited to have Ashish here with us because CK Birla in itself, I think it's probably 5 decades old institution, right? And has seen it all. I mean, from a traditional system perspective to a hyper connected world where we're sitting now, where patients want everything on one click, right? So I am extremely looking forward to learning from Ashish on how the healthcare system, according to him, is working towards meeting these evolved needs of the patients. How we are creating a wonderful patient experience journey in the healthcare providers ecosystem, and also how can the patients eventually benefit from the digital transformation that is happening in healthcare sector, right? So yeah, looking forward to this.
Definitely. Thank you so much, Shraddha and Ashish. Yes, we have a lot to unpack here today. And before I waste any more time, I just have a few pointers to the audience. So, yes, during the webinar, we will have a couple of polls. Please do respond to them. We'd love to hear from you. And we also have a questions tab. So, if you have any questions during the webinar, feel free to put that up there. Towards the end of the session, our experts will take them up. And if you're facing any audio issues, video issues, just refresh your page, and yes, of course, you can join from your phone as well. Okay, so with that, I think we're off to a good start. So yeah, over to you, Shraddha.
Thank you so much. And welcome again, Ashish. And for audience, I think all of us are on the same page where we say that, the last few years, maybe the last 2 to 3 years have transformed exceptionally. Maybe, more than the transformation that has happened over the last 10 years, probably, right? And during COVID, beat you, beat me, beat, all of you, I think there's been an evident shift in what I would call a behavioral shift, right? In the way we demand for items, let's say across the verticals, maybe retail or travel or hospitality, right? We want everything on a clicks play, right? And where the moment I enter, I am able to kind of see my information, my recommended choices, history, everything with the vendor, right? And Ashish, I'm sure you would be witnessing similar patient demands when you are trying to service them in CK Birla Hospital, right? I would like to understand from you around your thoughts on these trends. Do you kind of agree with them and the changes that the healthcare industry has gone through the last few years? And what sort of challenges have you been facing? And what kind of solutions are you planning or have you already implemented to kind of address these challenges?
Yeah, thanks, Shraddha, for raising this question. And specifically in healthcare, what we have seen over past 2 years and past 3 years, maybe including a couple of years, which went by the peak of COVID, any user behavior which goes beyond 3 to 6 months is a permanent shift and change of the user behavior.
Okay.
And typically in India, within healthcare, we did not had a system wherein we would look forward to remote or a telemedicine or an assisted telemedicine setup. So that is the first change that came in, I would say. I mean, reliance on telemedicine, remote consultation. The second aspect was that the expectation of the consumers in and around uh, the entire ecosystem. See, as a user, if we talk about travel, retail, or any other segment, we are accustomed to service which is way higher. And whenever we say call a contact center or drop in our interest, or for example make an online transaction, the users on the other end recognize who we are. They know our identity, and they do a lot of personalization. If you look at e-commerce and consumer internet, the entire user behavior shift within use, and the effort to generate stickiness is always around personalization. And I think which is where even the healthcare industry has gone about that shift. And when I say personalization, it is not just from the point a customer actually initiates his touch point with us, but also when it comes to walking into the hospital, getting the entire experience. I mean, traditionally we have seen long queues at the hospital, and when we talk about metros and even tier one cities, now with, I mean, that advent of making a transaction online, and the ease of making a transaction online started with doing away with the queues. Now that meant for a healthcare provider wherein the technological ecosystem is not as well advanced as we see in consumer internet or an e-commerce industry, to transform the entire backend IT system, transform the entire mechanism in which they capture payment. And then once you initiate a touch point online, and then you land offline to a hospital or a clinic. So reducing the cycle time, reducing the entire queues. And the third expectation which people have is they should get their reports or their consultations right at the single right at a click of a button. Now that is again shifted. So one, of course, is the click of the button. Now people want it right away, even on their WhatsApp as a push notification. So the entire expectation has shifted overall, and that has meant a lot of technological transformation, both in terms of on the user side, on the consumer side of things, and making things more automated, being available right at one single click. The second aspect of transformation is that in India, we do not have digital health records. And with the government initiative around digital health, the impetus of healthcare organizations to shift towards electronic medical records. And also, this helps us as an organization or a healthcare provider to create an entire online record. And also this helps us create an entire CRM system wherein we can track the entire life cycle journey of a patient, and then create a personalized communication, create a personalized reach out to them whenever we are speaking to them. So this transformation has led to a lot of technological adaptation within healthcare, and also from a healthcare perspective, I would say more innovation, from not from a paper based system, from a physical queue based system, from say I mean, even for getting an appointment, you have to go to the hospital or call them, to an online system, to the entire chat based system. So that adaptation has come in. And the second is the fulfillment of the expectation of the customer, which is on the more personalized bit, which is where enabling technology acts as an enabler to deliver a personalized service, not just and not just at the hospital premises, wherein say a nursing station, or even at the level of a billing station. But all of these combined, technology has become a big player. And it has also led people to evolve their entire customer management system and entire the way they capture data and the way they organize and structure data in order to retarget these users or remarket to these users. That has become very, very different.
Interesting. That's great to hear. And Ashish, I think you've left a lot of points to for us to kind of talk deeper about, be it around data or maybe the reminiscence of patients in the queues, right? I still remember during COVID, I think. In June 2019, when this norm came up that telemedicine or teleconsultations have to happen, and all the hospitals were not prepared at that time, and India phenomenally, represented a great show of how we, created the vaccinations for all the patients, or maybe the consultations for, let's say, asymptomatic patients, right, across the hospitals. And that was the beginning of the era of the chatbots, of the virtual assistants, or maybe the usage of higher customer relationship management softwares to manage such high needs of, let's say, beds or patient inquiries, etc., right? Super excited to talk about these a little deeper, but on a economical side, right? You're an institution of business, right? And I think healthcare businesses work very differently from the rest of the businesses where they're chasing the consumers, right? At least traditionally, all the manufacturing hubs or real estate hubs have been chasing the customers, have been running after the customers, whereas healthcare providers did not have to do that. Patients used to do walk in, and there was no personal reach outs from the hospitals to get more patients in, right? But given that we're now moving to a place where customers want to be reached at every touch point, and you as an organization, you are aiming to maybe open 100 plus fertility clinics, right, in 3 to 4 years. What does this mean to you? What are the top, and you've talked about technology investments a lot, in your previous answer. So in order to scale to that level, and India is a home to maybe 28 million plus couples, right, for fertility issues. So I mean, 100 plus fertility clinics is going to maybe address a mass. So how do you plan your technology investments? What are the top three areas, let's say, where you're looking to invest to digitally transform your organization?
So when we talk about top three areas, the first one, of course, would be in the hospital information system and the entire electronic medical record, which is
Okay.
where once a patient lands in, we digitize the entire record. And
Okay.
taking a step back, one is, of course, when you talked about 28 million couples who are going through fertility issues, and when we are looking at fertility as a market,
Hmm.
that means that capturing their information, and also fertility as a segment is where the education of the customer in a market like India is very low. It
True.
is because of our cultural construct, and also because of the unawareness or known unknown unawareness about the topic. Even the
True.
best educated people do not generally realize that they kind of have a fertility issue, and the entire knowledge and know-how, again, for around male infertility is very, very less.
Hmm.
So the second point is that how do we invest in an engine through which we can create awareness once we have gotten an information and input from the consumer, creating an awareness and creating a touch point where a trust is established. See, in healthcare, whether it's in healthcare delivery or within fertility, trust is the first factor which comes in. And that comes with two things. One is either you would be referred by somebody
Hmm.
or a word of mouth, or secondly, either you are a very big revered player in the industry. So in accordance to this, or in conjunction to this, the trust comes in when we manage the entire communication engine with the patient and keep it live for certain amount of time.
Hmm.
And then, which is where, and that is the second aspect. The third is, how do we reach out to these 20 million, 25 million people? Definitely one is, of course, digitally we can reach out to so many people. And again, there is a field team which reaches out, which again have got certain, I would say, 10% effectiveness than a digital team.
Hmm.
But the amount of effort, energy, and the investment within a sales team is much higher, which is where the need of an engine to collate, organize all data,
Hmm.
reaching out to the consumer is also the third aspect, is that creating segments within the consumer who are at a different
Correct.
stages of decision making, and reaching them out through various channels. So it the second aspect is the need for an engine which creates one is engagement, which also gives me a visibility of the interests which has been captured through different sources at what stages of life cycle they are in their decision making journey. And the third, it helps me also educate people at various junctures within fertility, given it's a different segment altogether, and the kind of societal setup and the overall setup that we live in is very, very different.
True.
So this is the second aspect. The third, of course, is managing and organizing my entire database and entire data structure and system. Once we talk about 100 clinics, it means there would be a huge amount of upper funnel data wherein people would have shown interest. Then there would be a huge amount of patient data, and
Yes.
managing and organize it wherein I can have uh, proper segmented data, so that I reach out to these consumers through a sharp messaging or
Hmm.
a sharp communication, wherein I can fine tune my conversion engine.
Hmm.
So first, of course, is my hospital information system, which is the foremost. The second is creating an entire data capturing or a CRM system, which helps me manage all of this. The third is then which helps me. The third part is that how do I create data structures at the back end, which help me segment and reach out with sharp messaging through definitive communication channels uh, that I reach out to them for, and also the measurability of the entire
Sure.
exercise. So digitally, we all know that whatever penny we or whatever money we spend on each of these consumers, I mean, the beauty of digital versus an offline channel is that it can be measured at every point,
True.
and that is where the need of a platform which is more measurable, which is more apt and accurate comes in.
Hmm. Interesting. So, I think these three things, right? You're talking about HIS. Along with HIS, I think there's so many other clinical, non-clinical softwares also that healthcare organizations have, right? And that obviously, leaves a discussion open of integrations, right? Which we'll maybe cover in the later part of the section. The second part is CRM. Now, CRM is enabling 360-degree view for HCPs right now, right? Kind of integrating their clinical, non-clinical softwares or EHRs or the HIS, etc. Right? So and also the way you're talking about the entire patient journey, does this also mean that you're segmenting your internal processes? Let's say during the patient care or pre the patient care and post the patient care, right? Which are the areas where you're seeing most impact happening, or which are the areas of your focus when you talk about, let's say, a CRM or the data needs, etc.?
So, see, when I talk about HIs once I am able to convert the patient, and then I go on to
Correct.
modify my HIs. But before that, nurturing my lead, the moment somebody has expressed interest, nurturing my lead, even if I am targeting a different altogether a different market or different markets in India
Hmm.
via digital channel. It may be via Google, Facebook, or a display ad, or DV360, or any of the channels we have in the under the sun.
Hmm.
So once a person expresses interest, touch basing with him at every point in time, at every stage of the journey, wherein he's a lead to an outpatient customer. So touch basing him at every stage, and that too at every stage of the journey, if he is a customer belonging to a different market. See, the difference within healthcare is that, though, I mean, whenever we call to a hospital, we don't mind the language selection, we just want to speak to the person. So definitely in North India, Hindi floats more, and in South India there would be a South Indian language, Tamil, Telugu, for different regions. That is where, and when I say trust comes via two things. One is, if I speak your language, I'll have your trust.
Hmm.
And a doctor who would be talking to a patient who does not speak a patient language will never, the patient will never trust the doctor. So that's the first thing. So earning the trust, which is where going vernacular up, I mean, which is where the need for a lead nurturing engine comes in.
Hmm.
And when I say lead nurturing engine, that is one aspect of thing. The second is, once a patient comes in, and there are other channels. One of digital is a larger channel, I would say. Sales would be another channel.
Hmm.
So how do I track my entire patient journey? How do I track my entire experience on one single platform?
Hmm.
Even for my and one single platform. And how do I know that, for example, somebody has taken a injection, then he needs another injection which is due? Within before an IVF, there is an IUI process which comes in. So what is the due date? Should I, if that is the due date, should I send a communication message to him? on a particular due date? Should I send a preparation message to him? There
True.
is a whole lot of activity process, and within IVF is a very emotionally taxing journey, which is where a lot of communication and that trust build up will happen over a period of time, no matter however large or big the brand is.
Hmm.
But obviously, reaching out to the patient, earning their trust is the biggest factor. So that starts with patient engagement. That once there is an OP journey, OP to IP journey, and then IB to pregnancy. And given we are also into hospital business, so definitely my life cycle journey is not just 1 year of IVF, but it is beyond that. 1 year of pregnancy, and then there are 2 years of childcare, which happens pediatrics and all of it,
Hmm.
and the vaccination piece. So
Hmm.
it's actually 4 years of journey. If I'm able to consolidate all of it in one platform, that gives me a huge value out of it.
Hmm.
And if I'm not able to do it, if I do an IVF, leave the patient, and even before that, if I do an IUI and leave the patient, I leave the value on the table.
Hmm.
And secondly, to earn that trust on the brand, it is also, we as a healthcare provider also take it as an opportunity to make the user know and understand about the entire process, make them learn, make them, and give them an opportunity to know what goes on, and entire nuances, not technically but functionally, and at an overall level we are able to speak their language.
Correct.
So this is the overall life cycle journey which we plan to cover, and post that comes the entire HIS and everything.
Hmm.
So this is the first and the foremost engine which comes in a market like India, in a category which is very very unknown, and which is where a lot of there is not much knowledge even with the SECA customers whom we look at in different metro markets as well.
Hmm. Got it. So I think you would also then cover the patient journey across the various channels also, because the customer or the patient might just keep moving, right? You're talking about a 4 years journey, right? And post that also, once a baby is born, then it's another lead or another kind of patient for you in the system, right?
Yeah.
So what you're talking about essentially is the patient engagement across various locations or various service lines that you have, as you talked about pediatrics and other departments, and also multiple channels, right? And not just this information have to be I think awareness centric, but as you mentioned, it also have to be extremely predictive and precise, right? So when you talk about those predictive and precise analysis, and I'm kind of gathering back from where we used to learn that hospitals have this key phenomenons of 3 A's, talking about accessibility, affordability, and awareness, right? Now you are kind of adding layers to it, right? Precision, predictive, or maybe preventive for that matter, right? Like you mentioned, that which injections have to be taken at what time, and is it liable or not. Do you think mere patient engagement, as we are naming it, in today's world, will suffice to kind of meet all of this, or are we talking about an entire patient experience here, across the years, and maybe not just patient, their entire family? And as the government is also taking initiatives around EHRs or ABHA numbers, etc., will we see a lot of initiatives, being re-strategized, taking care of these government initiatives in play also? I mean, just want to understand what is the scope of the overall patient experience that we keep talking about here, and how significantly is your patient outreach program is evolving with these government initiatives in play?
So, at an overall level, patient experience, as you rightly mentioned, is a very small subset of it.
Hmm.
Uh, and it's an overall build, sorry, patient engagement is a very small subset. The entire set is more about patient experience. And if I were to take a step back 4 to 5 years back, even in top tier metro cities, we
Hmm.
would have never imagined that we would go for a primary health checkup, and that too there would be a flebo coming to our home, and it would be a retail product.
Correct.
And right now, as we speak, it is a retail product. We don't even think about taking such a test, and all thanks to the entire digital initiatives and all the promotion, and all the different startups which actually revolutionize this space. And it also created an awareness amongst people to stay healthy. Staying healthy is not just about staying fit, going to the gym, managing your weight, but it also meant that you have regular health checkup,
Correct.
which is not forced by your insurance, of course. So this is where the entire consumer experience and awareness buildup was created.
Hmm.
So when you talked about experience, it is also about within healthcare. We look at one, of course, within our entire life cycle journey. At some point in time, whether we need a healthcare provider for us, for our family, for our known near and dear ones,
Hmm.
the first, the entire recall value
Hmm.
of the entire healthcare ecosystem comes in when we actually have a overall patient experience and a delighted patient experience delivered on time
Hmm.
with the right solution. And also, we are, at the end, when a patient exits, he is a happy customer in true terms. So
Correct.
which is where and of course, when I said trust is a big role, has got a big role to play. And people, we also, we have seen, we have had family doctors whom we don't leave for years and years, 30 years, 40 years.
Hmm.
This, that has transformed now, and at some level, people now go to a multi-speciality hospital, and which is where they once they get a great experience, they just don't stick to that, but they bring in their families and known ones as well. So
Hmm.
it is about creating an entire delightful experience right from the start of the journey to managing the entire life cycle, where we know about the patient more than he knows about us.
Hmm.
And that is where, when I talked about electronic medical record and capturing all of these data in one place, the government initiative is now revolving around the entire digital health and the entire digilocker thing, wherein you keep all your health records and can be accessed by any hospital. And which is where a lot of these players, even the HIS players, have to transform their entire data layer, have to go through FHIR compliance, and all of it. But now the outcome of it is that within next 2 to 4 years, India would be a market which would be at par with US when it comes to compliance on health records, which can be accessed at a single click. Now, at that point in time, where a hospital or a healthcare provider would be able to make a difference. If I am a provider, there are 10 more providers in a city, and everybody would have the same data, access to data which I have. But where the difference would be, if I'm able to engage, provide an engagement at every level, at every stage. When I say, and as we spoke about it in the beginning, when a patient comes in, or when a patient actually is searching on the internet and comes across you, makes a click, and there, or he calls into your contact center, drops an interest, and then once he walks into the hospital. So is there an experience wherein I have made the journey seamless for the customer till
Hmm.
he reaches the doctor? Even after he reaches the doctor, is his report delivery getting to him on time,
Hmm.
maybe through a WhatsApp push, or through a customer portal, on which, on a single click, without having to create an ID, it is downloaded,
Hmm.
and then he can access it.
Hmm.
And secondly, if there are electronic medical records, for example, within a hospital, see, the gold mine is electronic medical record, where there are diagnostic tests
Hmm.
involved.
Hmm.
And a lot of diagnostic tests is a revenue leakage for any clinic or a hospital.
Hmm.
Now, if that EMR is recorded, and if you know that doctor has recommended these four tests, and if there is a cycle time of say 4 to 5 days, once you exit the building, you will definitely go to two more places to check that out. And
True.
that is how the market is. That is how we are. We look for pricing. We also look for quality within healthcare. We don't compromise price on quality. We also look at proximity to our homes.
Agree.
But eventually, if we are able to reach out to those people just in time, and secondly, with a promise to deliver the outcome in the best way possible, with the best, within the shortest possible time,
Hmm.
that is where we are able to create a differentiator. And that's where, I think, it is going to be a game changer in times to come.
Hmm.
And whether, when I say, speak of this, the entire and internalizing that EMR into entire customer engagement and customer life cycle management would be one larger piece which will play an important role in the upcoming years within healthcare.
Interesting. Ashish, with this vision, I see a lot of competition also happening within the healthcare provider segment, right? If all of you are gunning towards making the experience solid, and for a patient, it's not just going to be the doctor's profile now; it's also going to be the overall hospital experience that they are receiving, right? Now, in those times, right, a few data points are also suggesting that let's say 71% patients have agreed to be contacted via text or via several mediums of online communication, right? But only 21% do actually receive this sort of information from the hospitals internally, be it their doctors or clinicians, etc., right? So where is the gap necessarily, and how will you differentiate in this journey of making this a seamless experience for the patients when they go home?
See, one, of course, as I said, the gap within a healthcare system is all the integration that all the systems talk to each other.
Hmm.
Uh, I mean, I come from consumer internet versus when I saw at healthcare, there is a huge difference between the entire systematization and organize data organization, and also clubbing all the systems together so that you can create segments and touch points at various stages in a user journey, which is not in a mature stage in any of the healthcare provider. And at some point in time, we are also users, so I can very well comment that okay, none of the healthcare providers have this experience wherein you have got an entire 360-degree experience, right from you
Absolutely.
start searching for it to exit. And even after exit, if you have got 5 tests, for example, somebody has got a lifestyle disease, at what time he should get tested, and these are the 5 recommended medicines. And this was a doctor he looked at, and he had recommended five of these things.
Hmm.
And that can be integrated with, say, if a doctor says that reduce 5 kgs, then he wants to integrate that data with his fitness app, and it automatically tracks, and that feeds the data into the system that whether that has been achieved or not.
Hmm.
So at an overall level, data integration and data organization is one bigger, I would not say challenge, one big problem to solve for, because within healthcare the core has never been tech, and the core has been providing patient the right experience, treating them right. But
Agree.
now, given the overall user behavior has shifted, the competition has shifted, the core, the shifting to tech is very important. The second is, once the shifting to tech happens, integrating and making all the systems talk to each other.
Agree.
That is the second aspect. Once these systems talk to each other, now creating the entire data layer and creating the intelligence around data,
Hmm.
that is very important. Once you create an intelligent data and you know at what touch point you are going to market to whom, so then that is where you get a value out of the data that you have stored in the system. And within any healthcare information, hospital information system, any of these larger hospitals or even mid-sized hospitals would not have anything less than more than a lakh of patient data, who would have visited, revisited them so many times. But eventually, the utilization of data at certain touch points and at certain is not being done. So that's where there is a revenue loss, and also people go from one healthcare provider to the other. I mean, we don't leave, and that is where the entire shift has to come. So one is obviously the integration, the systems talking to each other. The second is whatever data is there, the right utilization of data to target these people through right channels at the right point in time.
True.
So integrating my entire electronic record with marketing
Hmm.
is very, very important. And marketing in healthcare would, I mean, to be very sensitive to it, marketing would not be the right word, but also the right word would be reaching out to the consumer just in time, in order to tell me that okay, boss, you are due for this, so you need to do this and take care of this. So all of these are very, very important, which is these are the two things that will bring a great differentiation in any of the healthcare providers who are able to take this journey through, and are able to successfully manage this.
Interesting. But does this also, do you think this will also change the traditional doctor to patient connection? We're no more talking about just, the care that you're providing to them or just the patient treatment that you're providing to them, right? Historically, we've seen patients would be running from hospital to hospital as the doctors are also going there, right? So you're one talking about, going from one hospital to the other because of a treatment differentiation. But we've also seen them traveling from one hospital to other because of one doctor they have, you know, um, witnessed a great experience with, right? So how do you control that, and you're talking about integrations, and you're talking about seamless patient experience journey that you're trying to create. Now, losing such a patient might be a lot of revenue loss for you, right? So how do you control that, and how does this doctor to patient connection evolve over time?
See, one thing, of course, the doctor evolution of doctor to patient connection is, I would take the liberty of using the word marketing. In marketing, what happens is, over a product you prefer a brand,
True.
and then if I promote my hospital brand, if I provide an entire experience around the brand, then which is where the propensity of a retention of a patient becomes very, very high. And second is, if I mean the communication that I make to the patient is not from the doctor, but it is from the brand. And
Agreed.
from a brand perspective, the recall value, the attachment to the brand supersedes the value at that point in time. And of course, when a doctor moves, there is a certain loss of patient. And I'll take the liberty of just quoting a broad level number that at some point in time we are able to retain 70 to 80% of the people once the doctor leaves. But there are 20% whom
Who
uh,
still
of
live.
which who come with the doctor and who will go with the doctor, which is what I think any healthcare provider should be okay with. But retaining 70 to 80% is a large number in today's term. But definitely that requires a lot of effort and investment on the managing the entire customer life cycle journey and providing that experience. And experience cannot be just offline once he walks through the hospital, but creating a complete online experience. And trust me, in healthcare we do not have any online product user journey for any of the hospital providers. I
True.
mean, there are health tech companies who operate differently, then there are hospital companies who operate in a different operate differently, but there is no online product user experience which a hospital provides. And that's the particular reason wherein none of the hospitals have been able to launch their app successfully or get an app downloaded. Who wants a hospital app? I don't want it. But merging it up with any of the requirements of the customer and understanding it, that is where you win the customer for life. You don't A doctor would not win the customer for you, but you win the customer as a brand. So
Agreed.
that even that transformation as a hospital or a healthcare provider needs to be done. For example, what I said, if you go to a, say, a lifestyle, if somebody has got a lifestyle disease, he's obese, he or she is obese, then he has to lose 10 kgs. Now that information gets lost. It is not connected to a fitness app on your phone, and neither the hospital nor the doctor knows it. You walk into the doctor after 2 3 months, and a health tech company actually uses your record.
Sure.
But then the health tech company is not able to provide you with a solutioning or a medication or the right prescription to it. Now it is two different people in the ecosystem. So even the upcoming times would require, I mean, the entire forward integration of the healthcare ecosystem. See, right now we have got the entire backward integration. It
Correct.
is just like the industrial revolution where entire industries were created, but the forward integration of distribution and actually supplying it globally, that evolved after, say, 100 years. I mean, it started from England, and from England it spread to US and then the Asian countries, but the entire supply chain was built many years later.
Yeah.
But that was a downstream application. And I think targeting customers downstream with the data richness of data which these hospitals have will help these hospitals retain these users for life, and they would not go away with a doctor. And definitely also this will help a user. I mean, at some point in time, if you are able to get into a device of the user as a hospital provider, that's the biggest win you have, and be there for years. I mean, otherwise a hospital app, I mean, we don't nobody wants to fall sick. I also don't want to. So having a hospital app does not serve the purpose on the phone. So that's the forward integration that we should look at, and I think that is the way to go in upcoming times.
Excellent, excellent. I think we've, to audience, I think we've learned several ways onto how technology or marketing automation, as Ashish is talking about, or sales effectiveness, is helping the hospitals not just, connect the right journey mapping of the patient, but also helping the patients in a lot of ways, right? Maybe to reduce time, save time, of switching from one brand to another, saving costs, helping them with awareness measures, or reaching out to them on every touch point possibility, right? Ashish, I'm going to take a quantifiable question from you now, right? So you've been using Lead Squared for multiple years now. I
Yeah.
think not just you guys have been using us. Maybe we've been learning a lot from your journey, right? Being a traditional organization, and having legacy systems, right? Your organization has shifted to using a technology like CRM, right? Was the implementation journey, deployment journey difficult for you? There is still hesitance to kind of have this sort of transformation in healthcare organizations, right? So what do you kind of suggest to the other players out there, or how do you suggest the deployment should be taken up in a healthcare organization to make it seamless?
So, see, one, of course, I would say any tech or any transformation in any organization is not easy to deploy and adapt. That's first. The second aspect is that to in order to make the users adapt to it, so creating an entire workflow of the users. And within healthcare you cannot separate operations from marketing, and you can't separate operations at all. So operations is an integrated part of healthcare system, unlike any other industry, which is where if I make the life of my operations guy easier, and if I help him do their daily task in a much seamless way, and also because an operations guy is measured on many parameters. Of course, PSAT is one key a parameter, and if I make his life easier to record patient data, to track his patient, and in case of say an open IP patient wherein he has to follow up, or a TBA patient, and if I make it all available on one single touch point, and every morning an operations guy comes in and sees that okay, these are the 10 things that I have to do, that is where I can drive adaptation for operations. So I'll go segment by segment, and which is where I think we have deployed it for operations as well. Which is where if a lead comes in, then there is a marketing. It is a marketing qualified lead, and from a marketing qualified lead, it becomes a sales qualified lead, and finally he lands into our clinic or the hospital. Once he lands in, tracking that journey is very very important, and I can't ask my ops guy that okay, you log into my HIS, then you log into Lead Square, and then you log into my appointment management system, and then you see that okay, where is the appointment created? So creating one single window, creating it as a simplified version, and also making it accessible, not just because an operations guy is on move in the hospital, he does not necessarily sit at the counter. So making it available on his mobile device is very very important. Now this is for operations. For marketing, definitely marketing folks are more tech driven. When I talk about digital, adaptation in them is not a problem. But now having said that, the ease of communication, the ease of segmentation, integration with different platforms, downstream communication platforms like SMS, WhatsApp, email, different vendors should be very easy. Upstream platforms like HIS should be much easier, and that is where the entire data integration comes in, which is much easy. For example, creation of data tables within the platform, and then easier to segment them, create different segments, create rule engines to reach them out at different stages of user journey with different sorts of messaging through different media. That is what makes my life of a marketing guy easier. So that ease of access, ease of usage, integration should be there. Now having said that, within healthcare organization we do not have a data integration layer. So generally all these tools are directly integrated into the system. They would be directly integrated to HIS, they would be directly integrated to your Google Ads, but then it is much easy. So it should be easily operatable by the marketing guy in order to, and it should be self-serve, easy to use. That is on the second side. The third part is that on the patient side, once I have done for marketing, I have solved for operations, my operations guy uses it. On the patient experience side, what helps me drive my inpatient experience, what helps me drive my conversions
Hmm.
till the end point. I mean, I should be able to track it and the revenues. If, for example, I invested $100 in marketing, what is the ROI I am getting out of the person once he walks in? And if he walks in, it is an IP patient. Yeah, then if an IP patient, am I able to convert him through an online media? If my operations guy does not have a visibility, if I as a marketing guy does not have a visibility, so I can't actually reach out to my IP patient and tell him that boss, this is the recommendation of the doctor, this is where you should come, and this is what we have to offer, and these are my happy patients. Look at them; these they have been cured, they have been solved. And for example, in an orthopedic surgery, if I am able to tell that okay, my patient is able to walk within one day in a total knee replacement, that is the journey, and that is where I would be able to convert a person and establish that trust.
Yeah.
For a doctor to build that ecosystem, it takes years. I mean, medicine in itself, for example, a first generation doctor takes off his entire journey of being successful at by investing somewhere around 15-20 years.
Hmm.
But this as a hospital, happy patients, communication at the right point, right person, that helps even the doctors to get the throughput for the patient. And now when you talked about when a doctor goes, the patient goes. Now this creates, I have brought a patient for the doctor has not brought a patient for me. So that definitely creates a stickiness of the doctor with us. So
Hmm.
that is the difference that the entire ecosystem brings in three parts. One is of course for marketing, The second is for operations, and third is the post patient engagement, which or the conversions piece, managing the entire conversion piece.
Excellent. We have a lot of ROI matrix that you've laid down, in this particular answer, right? And I do also know that CKBH in itself has been phenomenal in driving data segmentation, right? A lot of reports, a lot of measurable outcomes that you keep analyzing the ROI story upon, right? Will be, very interesting to know. Does it also impact your bottom line in any way? I mean, when you're talking about the ROI story with the management, or let's say when you're using the CRM for these particular purposes, right, in operations and marketing and sales, is there a factor of bottom line as well in your mind?
See, when we talk about bottom line, within there are two segments of business in which we operate. One is the fertility part of the business, and other is the hospital part of the business.
Yeah.
Within hospitals, typically the decision making cycle for a consultation is very very small. But when it comes to IP, it becomes slightly longish. People explore. They
Yeah.
would go to 2 3 places, hear from the patients who have been treated. Even in IVF, that's the same story.
Hmm.
Now, which is where the entire engagement and education of the patient at different stages of user journey comes in.
True.
And when we kind of started using the entire patient engagement piece within Lead Square versus where we are today, the actual conversion rate we saw in terms of improving. So, see, it is always a assisted conversion model within healthcare, unlike any other tech company wherein you do an online payment. You have to call the customer.
Agree.
And to build the connect over the call, definitely there is a certain amount of pre-build or pre-nurturing that happens. Our connect rates improved within contact center because we were already in touch with them. We were already communicating with them at various stages in their journey. Now once our connect rate improved, then obviously my walk-ins improved and that conversion engine ramped up. And we saw, I mean, within early times we also do report that earlier versus now, definitely we saw a 40 to 50% rise in our connect rate, and that helps us trickle down, that trickle down in the bottom line as well. Why? Because there is a certain amount of marketing dollar you spend for acquiring these customers. Once they are acquired as leads, if you are not able to connect to them, then definitely that's a money down the drain. Even if it is through your website traffic or an organic traffic, then definitely there is a team involved, effort involved, and we also expect an outcome out of it. So definitely that adds up, and that helping us improve on the connect rate, because the customer always knows you. He knows about you, he knows about certain treatment, he knows about your doctor, he knows happy patients. So definitely there the propensity to convert becomes higher. Now this is on one side. The second side is all the preventive part of it,
Yeah.
and the third part is also on the pharmacy part of it. For example, if we have got a lifestyle disease patient, there is a certain pharmacy or a preventive part associated with it. We also know the billing of the patient,
Agree.
how much, when, and obviously there are certain players in the market who already do it, nothing new, but also integrating it with the entire journey. And when we talk about even women, childcare, pediatrics, there are certain stages of vaccination. And if a child is born in our hospital, we know that for 2 years there is a vaccination journey of the child. And of course, if we keep educating the one is the expecting mother, and post birth, post delivery, the mothers about how to take care of their child, when is their vaccination due, what they should do in what trimester, pre-birth and post-birth of child, what they should, how they should take care of their child. And definitely the propensity to get that person to our hospital increases and helps us improve the revenue funnel. And that is very very important, and that is what we focus upon.
Excellent. Good to hear a few kind words, about Lead Squared also. And, I think you've talked a lot about integrations here, and we've heard a lot about data from you as well, right? Around how, data exchange and how data security is very important for you, right? When you talk about data security and data exchange, what are the other protocols, or what are the other things that you're keeping in your strategy for the roadmap ahead? When you're evaluating the data vendors, or when you're trying to kind of integrate CRM with the data softwares?
See, right now, what we have is we integrate directly. What happens typically in the industry is having an integration layer.
Yeah.
An integration layer does not absorb the data, but it will help. once I pull out any data from the system, for example, tomorrow I want to change my appointment management system, then I'll have to rework the entire integration with all the systems. So one, of course, is the integration layer which we are trying to build, which will serve all, which will be a one plug and play model. The second, of course, is having a data lake which will absorb all the data from all the platforms,
Correct.
which is where and integrating directly with systems also poses a challenge. See, at some point in time,
True.
both your systems have to be working and saying they have to be seamless. But to overcome that challenge, build a customer data platform and link all your tools through that customer data platform. Then it becomes the interoperability of of the platforms become very easy for a CRM system to operate seamlessly. Linking it to a CDP is much easier and much better to do rather than linking it directly to the HIS. Because again, your HIS would have certain API limit. If you link, for example, the challenge that even we initially faced is if your X system has got certain API hit limit and you link 10 systems to it, then all of them would be pushing data at some point in time.
Yeah.
And then you cannot build in rule engines for API system for which you don't hold the source or the source code. Then definitely you are in a fix.
Yeah.
So definitely that integration layer helps. The second is linking your all, having a CDP is what works more, and that is where you can secure your patient data as well. So you secure your entire patient data right from uh, the lead to a surgery to even IP pharmacy, and further onwards, and also linking it to the family tree. So while in a healthcare ecosystem, we do not capture cookie data. I mean, right now the user behavior has changed. People come online, they search for it, and then they come. Especially they come through Google My Business or a paid online ad or an organic ad. So definitely the overall ecosystem has changed. So capturing the entire cookie data to the entire outcome is very very important to be done in a CDP, and linking all your tools to your CDP would help run all these systems seamlessly.
Mm. Correct. Excellent. I think I'm getting few pings from the team here that we should take some questions, but just want to kind of create a summary of what we've discussed so far, right? That a CRM is definitely helping with lining with the organization strategies of ROI. Personalizing not just patient engagement but an overall patient experience that helps the healthcare organizations increase their revenue, reduce their bottom line, create operational experience excellence in the organization. And as you said, it's not just a dollar based pricing model that the patients are looking for. It's a trust based, value based core that they are trying to achieve, right? And we are glad that we're partnering with you in order to achieve these outcomes. I will open it up to Kartika. Kartika, please, if there are any questions from the audience, we'll take a pause on our session now.
All right, thank you so much, first of all, Shraddha and Ashish. Okay, without further ado, let's move to a few questions. So, the first question is from Joy Neil. He asks, what's the kind of language that patients want to hear or communicate in? Is it short and lengthy, text, voice, formal or informal, or friendly or professional? I'll just put it up on the screen. Yeah.
So yeah, so basically, patients want to hear their own language. When you go to a doctor, if he talks everything about bio book terms, no patient would understand that. That's one. The second is, of course, vernacular. I mean, being comfortable and being short and crisp and being simply simple in the communication. See, nobody wants to hear a medical term and then go and Google it. That does not happen. So it is, and when it comes to which type of uh, uh, te- uh, yeah language works for them, for example, text or a video. So in India overall, on the digital platform, the video consumption of users is much much higher versus the text consumption, and it is also basis the what is it, demographics. In a tier 1 metro, nobody would open a video in office and look at it, but in a tier 2 tier 3 market, if you send a video in attached to the text, people would definitely look at the video. The second is also about the communication. If you're talking about patient experience, it cannot be a text. It has to be a video and talking to the person. So it is very, very customized. I would not say there is a thumb rule to it, but but it depends on the kind of messaging that you are doing, the markets which you are targeting, and the kind of consumers. If it is an SECA consumer and you are sending constant text WhatsApp message to him, he'll block you on WhatsApp. But if you are sending a text message, he can't block you. But it is an SSEB customer in a tier 2, tier 3 market, and if you're sending a video which helps him understand a particular ailment for which he might have consulted you, so definitely he will go through it, and the next time he thinks about consulting or taking an opinion, you'll be the first. You'll have the top brand recall value or top recall in his mind to whom he may come for the first consultation.
Definitely. Yes, I hope that answers your first question, Joyneel. We have one more question from him actually. He asked, should providers modify or amplify their organization structure to cater to the change that Ashish was talking about?
Yes, definitely. I think overall in healthcare, as I talked about, it was more on the patient or healthcare delivery, and that was on the on ground delivery. If we are trying to build a sustainable business and also being focused on bottom line and the way the markets are progressing and the way competition is increasing, I mean, European providers are, from whatever I've read, European providers are also wanting to enter India market, given the sheer population size we have. And if we look at even the absolute numbers on the propensity to pay, that is very, very high. So definitely the competition is going to increase. So that ways, yes, the transformation needs to be done. And the second is, of course, as consumers, you are using four more online platforms in your phone, and definitely the expectation of a consumer has grown. Even the user behavior has altered over last 2 3 years. So that in order to be in sync with that, definitely there is an entire change in the organization and the tech structure which needs to be brought in. And obviously, from whatever I have seen, the healthcare hospital information systems need to be more intuitive, more user friendly, even for the internal users to be able to adapt. And also, they need to be uh, more faster, much better equipped, and need not be slower. And even for that matter, on all the other allied systems, which are much new age. If I talk about any CRM system which is SaaS based, which is much more new age and much faster, in order to be in sync with it, so definitely the backend technology also needs to change. So that alteration needs to be done. Yes.
All right, thank you for answering that question so beautifully. Okay, I have another question from Dr. Rajendra. He asked, "Are these platforms operating as per National Medical Council's norm?"
Yeah, because National Medical Council actually does not allow sharing of uh, EMR through WhatsApp. So WhatsApp would not allow you to do that. So all of these compliances are being met by the partners itself. Now, when I talked about FHIR, which is more of a norm in US, that is going to come to India after we digitize the entire health record journey, or we move to entire digitized health record. That will come to India as a compliance to the cloud where we are storing the data, but that is 2.5 years down the line. But right now, yes, all of them are complying to the norms.
All right. We have one more question. I've gotten a couple of questions through email as well. So, since we have 3 more minutes, I think I'd like to share them as well. Okay, so we have one question. It goes like this: do you feel that customer service plays a key role in the healthcare industry?
Definitely, yes. A repeat usage behavior, or when I talked about trust in the entire ecosystem, that is driven by the entire service aspect. And healthcare is an extension of, I would say, hospitality, at some hospital plus hospitality. And definitely, if somebody has not got a great user experience, then this is lives of people, and we have to be careful in what we speak, what we tell, and even in terms of creating an entire delivery experience. So that plays a big pivotal role in it, and also there are compliances and legalities attached, so we have to be very careful when it comes to creating an entire experience around it.
Definitely. All right, so I'm just going to take one more question because we do have a time constraint. So quickly, I'll just take up one more question. What are the general blockers while engaging with patients, and how can we overcome them?
Okay. The general blockers right now, I would say, when I spoke about very sharp messaging, what is relevant for me? That is one. The second is nobody wants to be told about a disease or an ailment he might have. So the entire messaging, the way we communicate, the difference has to be more preventive, more positive, rather than being more diagnostic. I mean, as healthcare providers and even doctors, they are more diagnostic, and if we look at it from an engagement standpoint as marketers, we cannot be doing that. That's not the right approach to solve the problem. So definitely, it has to be more preventive, more in the positive direction, and more um, rather than diagnostic. It has to be a more problem solving, but still not being diagnostic at the same point. So the blocker, and then that is where we would be able to make an inroad into a patient's or a customer's mind and being be there at the top. And second, of course, at certain level, compliances are there. We can't surpass them and communicate everything. For example, when I talked about EMR, you can't send a prescription on WhatsApp, no matter even if a patient wants it, because that's not as per, that's not compliant as per Indian laws. You can send a test report, but you can't send a health record on WhatsApp. So that's the difference. That is also one of the blockers, because see, the expectation of patients today is that because they get everything on a WhatsApp push message, the moment they do a billing, they get it on WhatsApp. The moment they do a test, they get it on WhatsApp. So they would also like to get this done on WhatsApp. So that is one of the compliance blockers, I would say. But eventually, the DigiLocker and the Health Lock, Digi Health initiative of the government would help us solve a lot of that.
Okay. I know that we've crossed our 1 hour mark, so if we have maybe 5 more minutes, we do have a couple more questions actually. Or if we have to stick to the time exactly, we can wind the session up as well.
We can have one more.
All right, great. In that case, I have a question from another question that we've gotten from one of our attendees. So Radha Krishna asks how to engage patients post consultation and post discharge without disturbing without disturbing them, which is the easiest way to engage.
See, one of course is post consultation, as I mentioned, for what uh, speciality the patient has consulted for. Then the EMR comes in. There are certain data points in EMR. There would be certain diagnostic tests. Then there would be certain pharmacy. See, pharmacy refills, nobody feels bad about it. The second is, even on the diagnostic side, if a patient has already done a consultation, sending him a reminder, nobody feels bad about it. And the second aspect, so that these are 2 points. The third aspect is giving him creating an entire ecosystem of knowledge around it, a positive side, and that's what will never be nagging for a patient. Somebody might have a lifestyle disease, maybe a hypertensive patient. So maybe communicating with him, not how to reduce hypertension, take this medication, but how to manage his lifestyle, how to manage his fitness. So that communication would never nag a patient, and it would be more, and also creating a differentiator between generic messaging versus a very specific messaging, being very custom made for them. That is what matters more. If it is not a tailor made messaging, I would definitely not like to have that in my inbox, maybe a email or a WhatsApp or an SMS or whatever format it is. So tailor made for a customer, whatever is tailor made for him, they would definitely be interested, and it would not be nagging. Even after, I think the second question was post uh, checkout,
Charge. Yeah.
post discharge. And again, post discharge, the second part, even in the second part, the tailor made messaging, for example, post discharge, they have to consult a doctor after a certain number of days. Generally, hospitals call and ask the patient to come back after a certain number of days, but nobody talks about a messaging on the preventive care. If somebody underwent a surgery, what are the top 10 things? Even today, as we at some point in time, we or somebody in our family is a consumer, and we go to the doctor and ask him what we should eat after this surgery, and that is not an information even the doctor gives you a satisfied answer for. And you always keep thinking, oh, if this is something, this will create a problem. So definitely a messaging around the entire ecosystem which earns the trust, that will, and also helps the entire patient journey, that will always help. But then having said that, it requires a lot of work around in terms of creating these communication, creating the ecosystem, a help from the entire healthcare provider system, which is the doctors, their inputs, and creating an entire customer facing communication to it,
Correct.
not providing the diagnostics or the doctor inputs directly to the patient.
Yeah, I mean, just to add to your point, Ashish, even connecting or even integrating with their health apps for that matter, right? Wherein you can track their activities post discharge and kind of give them triggers for what is going wrong and right, as per the preventive measures that they have to take post care.
Okay.
Yes, thank you again, Ashish and Shraddha. I think we are way past our time right now, so yeah, I'd like to wind the session up. Once more, thank you so much, Ashish and Shraddha, for taking the time and coming and joining us. It was a wonderful session. I learned way more than I had come in the advanced stage. So thank you so much, and thanks again to all our audience. Very very good questions, wonderful, and thank you for always engaging with us and our speakers and keeping us going. So, yes, it is the holiday season, like I had mentioned. I hope everyone has a wonderful holiday season. And of course, we'll be coming up with more and more webinars in the healthcare sector and every other sector as well. All right. So, once more, thank you, Ashish. Thank
Thank
you,
you,
Shraddha, for
Ashish.
this.
Stay
Thank,
healthy, audience,
thanks,
Yes.
and
Shraddha.
happy
Thanks,
festive.
Kartika.
Thank you
Bye.
so much, Ashish. Thank you, Kartika.
Thank you, everyone.
Bye.